Nessie Knight Hospital, a facility built as a token of appreciation to those who participated in the Second World War between 1939 to 1945. Recently, it's faced challenges such as dilapidating infrastructure, resulting in the collapse of primary health care. Nurses' accommodation is another challenge facing this facility. Many healthcare workers feel demoralized due to their appalling living conditions. At this facility, some nurses live in caravans in a plot within the hospital.
That one is a very sore spot to touch on, because some people are living inside caravans which they bought for themselves, and because they're utilizing electricity of the hospital as well as the water, they have to pay monthly rentals for the hospital, to the hospital, sorry, and truly going inside the buildings that are not really well equipped, and then going home to caravans that are hot in the summer season and very cold in the winter seasons, because as you may have noted yourselves when you are doing the walkabout, they function more like zinc material. When it's hot, they're hot. When it's cold, they're extremely cold.
The health MEC says this financial injection will bring quality health care to the people of the area.
We're here today to invest 103 million in a program of major upgrade, renovation and alterations in this hospital, so that we can get to this ideal state-of-the-art hospital here in Nessie Knight.
Communities and those who work at the hospital have welcomed the financial injection, hoping this will improve services.
And this hospital was built using the mud by the then Dr. Patterson, which was working under difficult conditions. But now we appreciate now that the Department of Health has injected a lump sum of money that is going to be improving the conditions of this hospital, as it has been yet identified as dilapidated conditions. We appreciate that, and we are looking forward as the board to build the new hospital than to be revamping the old hospital, which is no longer meeting the standard of the new categories, for more special this time that we are looking for NHI.
Despite this initiative, there are still concerns from the staff.
We're very happy that we're receiving this from the department, truly we are. However, we would so like that our hospital be built from scratch, from the ground up, instead of being renovated. And there are a couple of reasons why we would like this to happen. Inside, when you're working inside the hospital, there are a lot of issues that we face as the staff members. You have to transport patients that are going down to maternity, down to the wards, and even the x-ray departments. The departments are not so close to each other that it is easy to refer a patient and to transfer patients from our OPD.
The health department says this program will be rolled out to other parts of the province.
In Tabankulu, in the outskirts of Tabankulu, we've got another almost 700 million state-of-the-art hospital with accommodation like this one, because our challenge is to attract skilled people, specialists, and all these professionals who are clinicians coming from all over South Africa. So if we don't have decent areas for their accommodation, we always are found wanting in terms of retaining them. So we are trying to address that as we upgrade our own facilities in terms of where we'll be providing care. We must also make sure that the people who are assisting us, our clinicians, doctors, nurses, have decent area to stay.
Rural communities say they see quality healthcare which is on the same par as urban-based healthcare facilities. Nurses also believe their well-being should be prioritized. Nkululeko Nyembezi, SABC News, Qumbu.